All right, guys, so we are going to talk once again about the nephron, which is our functional unit of the kidney. Sometimes it's better if you can just draw this out because it does get a bit complicated. So when we say that the nephron is the functional unit of the kidney, what we mean is that the nephron is what makes the kidney functional, right? So I used the example of the sarcomere and muscle contraction. Muscle contraction would not happen without the sarcomere. The kidney could not perform its functions of excretion and reabsorption without the nephron. So the nephron is going to make urine through 3 steps, and we're going to talk about those now. So what we need to remember, first of all, is that urine actually comes from our blood. So the urine is actually the result of blood that has been filtered, that has had things taken out of it, and has had things put into it. That is really what urine is. So the first thing that we need to remember is that we are starting with blood supply. So if you guys recall from the renal blood supply, we went through the renal artery, the segmental artery, lobar, interlobar, arcuate artery, cortical radiating arteries. Those cortical radiating arteries are going to branch into tiny, tiny vessels. These are microscopic, called the afferent arteriole. We know that afferent means bringing toward something, so blood is coming this way, okay? The afferent arteriole is going to bring the blood to this capillary network that we call the glomerulus. The glomerulus is a capillary bed, and we know that we talked about capillaries can be kind of leaky, right? They're the smallest vessels that we have. Leaving the glomerulus is going to be the efferent arteriole. And you can think about this efferent arteriole is basically going to end up back in our venous circulation, because the efferent arteriole is going to feed the cortical radiating veins, and that will go to our interlobar vein, our renal vein, inferior vena cava, back to the heart. Okay, so afferent arteriole bringing stuff to the glomerulus, efferent arteriole bringing it away. How do you know what's afferent and what's efferent? Well, the afferent one is always thicker than the efferent one. It's wider. It has a wider lumen. Okay, so we talked about you are basically bringing blood with all of its components into this glomerular capillary bed. And when we think about what's inside of blood, we talk about water, solutes like sodium, chloride, potassium. We talk about glucose is in that blood, right? Everything that we've just eaten, protein is in that blood. We also know we have cellular components, so red blood cells, white blood cells, right? We have all this coming in through the afferent arteriole. Okay, so then we talked about how the glomerulus is surrounded by this capsule that we refer to as Bowman's capsule. Okay, and Bowman's capsule is basically going to give way to this area right here, which begins our proximal convoluted tubule, our PCT. All right, so I use the analogy of having a water bottle, a plastic water bottle, right? And I have marbles and sand in it, and I punch little tiny pencil holes into the water bottle, and I let everything flow out. What is going to stay in the water bottle is going to be the marbles. What is going to be able to flow out of the water bottle is the sand. That is the same thing that's happening here when we talk about the glomerulus. So things that are really tiny, like our solutes, even glucose, so that is going to be able to move through this glomerulus. This glomerulus is like a sieve, so things that are really small can escape into Bowman's capsule. Things that are really big, like protein, white blood cells, red blood cells, those are not going to be able to move through into Bowman's capsule. Instead, they're going to move out through the efferent arteriole and go back into venous circulation. The important principle here is that whatever is in the tube is going to end up in the toilet. Okay, so if something is in this tube, and by tube, I basically mean the nephron. If something is in the nephron, it is going to end up in the toilet. Okay, so clearly we do not want to pee out our red blood cells and our white blood cells, right? So we are going to make sure they don't go through the glomerulus. All right, so these little tiny things are able to move into the PCT, and the PCT stands for proximal convoluted tubule. So it's convoluted because it's twisty, right? So at the proximal convoluted tubule, we also have this network of vessels that is surrounding the PCT, which we call our peritubular capillaries. So peritubular capillaries. And what we are going to see at the PCT is a process that we call reabsorption. Okay, so I really should have put here at the glomerulus, we see filtration. Okay, and here is reabsorption. So all reabsorption means is that you're going from the tube to the blood. And remember, if it's in the tube, it ends up in the toilet. So essentially, we are reabsorbing anything we do not want to pee out. So again, things like glucose. We don't want to pee out all of our sodium, all of our potassium, all of our calcium, right? So we're going to move those from the tube back into the bloodstream. And these peritubular capillaries, you can just say, will feed the rest of the circulation. So they're going to go into the venous supply and then back to the heart. They basically just stay in the blood. Okay? So that's what happens at our PCT, reabsorption. The next part of the nephron, right here, is called the loop of Henle. The loop of Henle does a lot of dynamic functions as far as concentration of water, like concentrating your urine. So, maybe I would have H2O move back into the blood supply. Maybe I would have H2O from the blood supply come back into the tube. This just really depends on the needs of the body. So for that reason, we are just going to say that the loop of Henle is all about sodium-water balance. Because remember, water is going to follow sodium. Okay? Following this loop of Henle, we have another capillary network that's called the vasa recta. So it kind of looks like a garland. You can see it in the model pictures that we posted. But that is called vasa recta. And again, it's just capillaries that are surrounding this loop of Henle. Okay? All right, so after the loop of Henle, the next portion of the nephron that we see is going to be the DCT. Okay, so now we have distal convoluted tubule. And the DCT is once again surrounded by these peritubular capillaries, so just blood supply. Blood vessels are surrounding the DCT. And at the DCT is where we see the third step of urine formation, which is secretion. This is the complete opposite of reabsorption. Instead of going from tube to blood, you're going from the blood to the tube. So this time, it's things that we want in the tube because we want to pee it out. So things like chemicals or toxins, drugs after they're finished with their half-life, unnecessary ions we don't need, excuse me, those are going to be secreted. So what that means is that we have all of these little solutes, the things I just mentioned, and then from the blood, they go back into the tube. All right, so that's what happens at the DCT. The DCT then will go into the collecting duct. And basically at the collecting duct, you've just formed urine, basically, right? So what comes out of the collecting duct is going to be urine. And of course, that is going to be emptied into the renal papilla. And then from the renal papilla, we go to minor calyx. From minor calyx, we go to major calyx. From major calyx, we go to renal pelvis. which goes to the ureter, which goes to the urinary bladder, which goes to the urethra, into the exterior of the body. So that's really how urine is made. You're starting with blood that you have collected. Basically, it's from the abdominal aorta. It goes through this branching system until we are at the afferent arteriole. That blood is going to first be filtered at the glomerulus. So this is step one of urine formation. We filter the blood. We don't want to pee out our red blood cells, our white blood cells, right? We don't want to pee out all of our glucose. So we're going to see filtration occur here. After filtration, the second step is going to be reabsorption, where anything that's in the tube, we put back into the blood. So this depends on the needs of the body, right? We don't want to pee out all of our glucose, our potassium, our ions, right? So we put those back into the bloodstream. We have the loop of Henle. You consider this to be like 2A if you want to. The thing is that depending on the needs of the body, maybe water will be reabsorbed, maybe water will be secreted. So we're just going to say sodium and water balance, it concentrates the urine. Step 3 is tubular secretion, which occurs at the DCT. This goes from the blood to the tube. So things that we want to pee out, things that we want to end up in the toilet, that occurs at the DCT. Collecting duct, we have collected the urine, which goes through this system until it reaches the exterior of the body. So that is the nephron in a nutshell.